Chairman, we are now live.
Good morning and welcome to this meeting of the Health and Wellbeing Board. I'm Councillor Alan McCrow and I'm Chair of the Health and Wellbeing Board. Before we start, I would like to explain for the benefit of members of the public who may be watching that today's meeting is being held in a hybrid format. We have a quorum of board members in the council chamber. I'm joined by councillors Heather Codling, Janine Lewis, David Marsh and Joe Stewart, also by Sean Murphy, April Perbedi, sorry, apologise, Dr. Heike Veltman and other board members and substitutes attending remotely include Belinda Seston. I'd also like to welcome, though they haven't joined yet, Alison Foster from the Royal Berkshire Foundation Trust, and Zoe Campbell, who is here, who is interim service lead for the public health and wellbeing. The meeting is being live streamed via YouTube, so members of the public are able to follow proceedings. Gordon Oliver is the clerk to the meeting, and Ben Ryan is the Zoom host. Thank you, Brian. Ben, sorry. Please note that only board members who are in the chamber could actually take part in voting. However, prior to any formal votes that are needed, we will hold an indicative vote amongst all board members, including those attending remotely, to give an indication to those in the room as to the views of the total membership. Finally, before we get to the agenda, just need to advise everyone there's a planned test of the fire and lockdown alarm scheduled for 10 a.m. Do we have any apologies, please?
Yes, Chairman, we've had apologies from Councillor Lee Dillon, from Paul Coe, Matthew Hensby, Gary Paulson and Sarah Webster, and Councillor Vicky Poole substituting for Lee Dillon, and Belinda Seston is substituting for Sarah Webster.
Thank you. Item 2 on the agenda is the minutes of the meeting held on the 20th of April. Are there any issues that members would like to raise on those minutes? There's been no problems with the minutes. Could I have a proposal that the minutes be accepted as a true record? Thank you, Joanne.
I'm happy to propose, as I was one of the people that was in the meeting.
And could I have a seconder, please? Thank you very much. So could I have an indication, please, for all those who wish to vote in favour of approving the minutes? Thank you very much. That's approved. The minutes from the meeting on the 28th of June are not yet available and will be brought to the next meeting for approval. Could I move on to item 3, actions arising? I'd like you to note the progress with the actions. Are there any further updates or questions in relation to any of the actions, please? We don't need to vote on this, do we? Okay. Can we move on then to item 4, declarations of interest? Are there any declarations of interest, please? There appear to be none. Item 5, public questions. Have there been any public questions, please?
We have not received any public questions, Chairman.
Thank you. Move on then to item 6. Any petitions received, please?
No petitions received, Chairman.
Thank you. Item 7, membership of the Health and Wellbeing Board. The membership is on an organisational basis, where we have a standing agenda item to note any changes in personnel. Since the last meeting, Helen Kenny has replaced Zahid Aziz as the Thames Valley Police representative. I believe that Zahid has actually retired or is about to retire. We don't need to vote on this item, it's just to note the change. Move on then, please, to item 8, building Berkshire together. Do we have Alison Foster?
We do. Yes, I believe Alison Foster's online, if not joining via Zoom.
I am on. Hello, I am online. I'm just trying to start my video, but it says I can't start the video because host has stopped it. So I don't know how to unlock that. So I'm here with Dr. Janet Lippett from the Trust as well. So just to introduce myself, I'm Alison Foster and I'm the Programme Director for Building Berkshire Together, which is the Royal Berkshire's new hospital programme, the name of the new hospital programme. Right, I think I've got it now.
So Alison is going to give us an update on the proposed redevelopment of the Royal Berkshire Hospital. Good morning.
Morning. So is it possible, shall I share my screen to just talk through the slides?
Yes, please.
Yes, okay. Hopefully this is going to work. Can you see them?
Yes, thank you.
Great, okay. So just to get everybody on the same page around the overview and background. So we are on the new hospital programme since 2019, and we developed our, there are 3 stages to developing the business case: strategic case, which is the case for change; the outline business case, which is analysing all the options; and then when you come out of the outline business case, you have a preferred option, and then you have a full business case that is all about going out to contract further services to build the hospital. So we've delivered our strategic outline case in 2020, and the new hospital programme over the last couple of years has been working on developing a whole programme approach. We are on cohort 4, so there are cohorts that are in have finished. So, for example, Leeds Leeds and Manchester are in development. Liverpool has been completed, but there are some that are in development at the moment. Cohort 4 means that we will be full adopters of how new hospitals will be built in the future, and they're calling that Hospital 2.0. And that means standardised designs. So instead of us all doing standard our own individual rooms or wards, that actually we've got the same standards to meet. So why don't we have standardised designs, and things like centralised processes to speed up the processes for business cases, as an example, and releasing funds for enabling works, and modern methods of construction. So that's where you can build much of the hospital off-site in a kind of factory production line kind of way, and then bring it onto site to be built. So it's anticipated that this will deliver economies of scale, and there'll be a reduction in time and cost to build new healthcare facilities in general through this approach. So we had 3 options in the strategic case, just to mention, to take forward. Oh gosh, it's zipping all over the place. So we had a whole new hospital on our current site, and potential for a new site, and we also had a part build, part refurbishment on the existing site as well. So we have been, the progress since that time is that the new hospital programme have agreed a total programme funding allocation in March of 20 billion. That was announced by the Secretary of State in May. There have been additional hospitals to that. The RAC, this is a bit of a typo there, reinforced autoclaved aerated concrete hospitals that really need urgent work, so they are to be prioritised. And also, if we all, with the addition of those hospitals, if we all went trying to build hospitals between now and 2030, there would not currently be the supply to build them all before that time. And some will take longer anyway as a result of some of the issues that they have to build going forward. So where we're scheduled is not been decided yet, but the next stage in our process is we work with the new hospitals programme to understand what is the option we will develop and deliver, and where will we be scheduled in order to deliver those. So our short list of options at the moment we are working on is 4 options, which is a standard going forward, and it is a new, the do nothing option and do minimum option are standard options within an outline business case process, and our 2 other options are to build a new hospital in a new site, or to build a new hospital on the current site. So just a bit about what we've been doing over the last, particularly the last year, is lots of engagement. You will have seen events. We've had events in Newbury, we've had a public survey, we've had stakeholder workshops. We've been reviewing other consultations that have happened. So, you know, Health Watch have also been gathering information. The ICS have been gathering information just to understand, get a real depth of understanding of the needs of the population, which might help to contribute to the development of the new hospital, and also start to build that community that will help to co-develop where we can our new hospital once we start to proceed. Our clinical services strategy, which was approved in 2020, we've now been developing that into a lot more detail, called the clinical model, and we've been working with system partners to do that. Digital is going to be extremely important to helping us build our new hospital. So we've been looking at how we can support digital tools and techniques for people right from the start of their journey right through to where they might need support in hospital. We've developed our green plan and have been implementing our plan for net zero across, working across the system to do that. And it's going to be extremely important to look at what a net zero hospital will look like in the future. There's lots and lots of work going on nationally around that to help us to do that. So hopefully we'll get a lot of support to get us to that. And of course, our outline business case process we've been working on too. So just to say the immediate next steps, and some of this is a bit of language. So we will work with the new hospital programme on our minimum viable product, Hospital 2.0. So just to explain that, Hospital 2.0 now has a set of standards. So for example, single rooms mainly. It will have digital standards, net zero standards, different standards in terms of space, learning from COVID and things that have happened during that phase. So what is our hospital now that we designed a couple of years ago? What does that look like with these new standards applied to that, and how much does that now cost? So there's a bit more of a cost exercise to take place over the next few months. We're reviewing and updating our strategic case. So we're submitting what we call a light version. So although we submitted it in 2020, there has been two and a half years that's passed, lots and lots of learning since COVID, changes to our clinical model. The ICS integrated care system has developed, and so we want to make sure we've incorporated those issues, and of course the engagement, wider system engagement that we've had recently in that strategic case. So we will maintain regular engagement with public. We do run an online event every month. We have regular workshops. We go to events where people are having them. And so if you go onto the website, you will see that there is something going on where we're engaging with the public, patients, staff every single week. And if there are things that people want us to come to give an update or to engage with, we would love to and welcome hearing about that. We will continue the options appraisal work. So you see our options are a new hospital on a new site or a new hospital on our current site. There's a lot of work that goes into understanding the costs and the work and the timeframes involved in that. So if you imagine if we have now new standards in terms of Hospital 2.0, in terms of size and how it's got to be built. So we've got to bring in quite a lot of the hospital using modern methods of construction. The sizes will be different. How do we now do that on our current site, as an example? Is it feasible to do it on our current site? And if it is, what does that look like, and what do the timeframes look like? And we equally need to test that out with comparing it to the issues that might be presented if looking at alternative sites. So those are the main areas that we're looking at. A lot of work yet to be done to finalise our delivery plan, but I'm open to answer any questions people have.
Thank you, Alison. Do members have any questions, please? Or any points to make? Councillor Marsh.
Thank you, Chair. You talk about the engagement and the consultation. Are you able to give any indication of what people are saying? I'm particularly interested in the issue of the location, which, from a West Berkshire point of view, is not very satisfactory, and I don't think many people are happy with it. So is that being borne out in what people are saying, or?
Yes, so we had a survey that we carried out, which was analysed then by the University of Reading, and there were, significantly more people in that survey who said that they would prefer a new hospital on a new site. There wasn't preference. We didn't ask people for where that site should be, and we will be limited to what's available, should that be the case. But there was many people. The overwhelming was that we wanted the engagement was a new hospital on a new site. And we have some statistics. I don't know if it's on the website yet. I think it's going up in the next week around the exact details that were in that survey that we're happy to share. But yes, I mean, access is the biggest issue that comes up when we're talking about the new hospital on any site. So currently we as people will know, we've got issues that come up regularly in our engagement around parking, for example, and we've been doing a lot of work around parking over the last year to try and resolve some of that. So you know, we've moved quite a lot of staff off the main site. We've created a park and ride system that both staff and patients can use. So you know, we're trying to resolve some of the issues that are brought up in the engagement. We try and resolve where we can and more immediately, and it's not about just waiting for the new hospital, but access is by far the biggest issue that comes up in engagement.
I was looking at the figures that you quote. Presumably, if you did build a new hospital on a new site, you sell the existing site, and that must be, looking at its location, must be quite valuable. Is that factored into the cost of a new hospital on a new site?
It's factored into what we can raise, but not the cost. So at the moment, that does exclude the cost of a new site. And the sale value, we'd have to do a lot of work to make it a real to bring it up to sale value. So people think that we'll get hundreds of millions, I think, and we come across this in engagement events regularly. People think that it's like for like, so the sale will contribute to that. I think there's a lot of work to understand whether that's going to be the case. So that figure is at the moment, it's not very clear, and it's part of the next steps. So we talked about looking at alternative sites. We need to now understand how much those sites cost, what would be the cost of putting infrastructure in those sites where needed, and support structures around transport where needed. So that doesn't include in that moving, it doesn't include those additional costs.
That's very interesting and helpful. Thank you.
Councillor Codling.
Yes, I have a question. If the decision was made to do it on the current site, that presumably would mean doing it piecemeal, clear a site, rebuild part of it. Do you have a time frame on that as to how long it would take to build a new hospital on that site?
Yeah, so we did do an exercise a year or two back that brought us up to 2030 to redevelop the site, but that was if we started probably a year and a half ago, but that was not using the new approach that we now have to apply. So using modern methods of construction and the different sizes and requirements from Hospital 2.0. So that's exactly the exercise that we're now doing over the next few months, is to work out how long that will take, what is the phasing approach that would need to take place, and how much that would cost.
Thank you.
Councillor Stewart.
Thank you. Hi, Ali. What a huge task you have here. And thinking about the site, of course, I would imagine that quite a bit of the site is actually a listed building. So, you know, it would be lovely to think perhaps by some that you could just knock everything down and throw loads of houses on it. But of course, that absolutely isn't possible to do in quite a large part of the campus. My question's about net zero, actually. So a great target that, you know, becoming net zero by 2030, and that's 10 years ahead of the NHS goal. I just wondered, are there many hospitals that have in the UK that have already achieved net zero? Because that seems like quite a challenge. You've knocked 10 years off the target, which is, you know, admirable and rightly so. But I'm just wondering if anybody else has achieved it, and whether we're using their experiences to help us with that.
Yeah, it's a good question. Yes, it's definitely an ambitious target, and we've done that in line with system partners. So Reading is ahead of the game in terms of climate. They've been doing it since 2009, and Reading University have got some world leaders in terms of their academic credentials in terms of climate change and net zero carbon. So we've been working with them on how we look at some of the biggest challenges to achieving net zero carbon. So that's one of the things that we're doing in terms of trying to get some real brains on it. There is no hospitals that have achieved it yet, so that is definitely, except there is in the outer. In Scotland, there is a health facility, but it's a very small, less than 100 beds facility that has managed to do that on an island off Scotland, and I can send details of that. And we talked about that in our net zero update a month ago, and you'll see the video of that online. The other things that are happening is that there is a collaborative of universities plus industry partners coming together as part of the New Hospital Programme national work that's taking place to also put their heads together and industry innovations together to look at this. So our target is heavily caveated on the reliance on New Hospital Programme investment to help us to achieve that target. So without that, we are definitely going to struggle to achieve that. And we felt that we could do that because we were on the New Hospital Programme. We're anticipating a new hospital, and we're anticipating it to have standards and things in place that will help us to achieve that target.
Thank you.
Any other members have got a question? Councillor Lewis.
Hi there, Ali. Thank you very much for an informative presentation. I've not had a chance to really review the whole story, so I'm new to this. With the funding for all of this, is this just for the building, or does this include all the equipment that has to go inside as well?
So that's a good question that's come up. So we've had recently we've been doing much more looking at the costs that we need to apply using this Hospital 2.0. We understand that it includes some equipment, but we don't know how much the percentage of that equipment is. So, for example, it would be anticipated a lot of the equipment that we have would transfer across, but we may well need additional equipment or new equipment, and so how much of that is going to be accounted for. So we're still working through the detail of that, and it will be different. Some, it may well be different depending on the different types of builds. Some people will have refurbishments and some will be completely new build, so there'll be differences, and we're trying to ask New Hospital Programme, is there a percentage we can rely on in terms of equipment that will come across to us? So it's I'm sorry, it's not a very direct question, but that's the position we're in at the moment.
Thank you.
Thank you. Any other questions? Could I ask a question, please? There's been a lot of coverage in the Reading media recently about potential sites for a new hospital, mentioning Thames Valley Park and Thames Valley Science Park, which I was rather alarmed because for residents of West Berkshire who don't have access to a private car, to get to those kind of sites would be extremely difficult. What is the status of those sites, please?
So as part of looking at alternative sites, we do an initial exercise. So it's very, very, very much in the early stages, and we work with a property company, local property company, to identify properties that may be available, and that also meets there's a range of criteria that we've set, and access is one of those criteria, and access for our population. So it's in the first cut, those are the two that have met a lot of the criteria, but not all of them. So the next stage of the process is to look at, okay, if there are no public transport access to that, what does that look like, and how could we implement that? If parking was an issue, what do we need to look at, those sorts of things. So we're at it's the very first cut of here's 2 potential sites that we are looking at, and also by putting that into the public domain, if there are other sites that weren't on the market that might be available, sometimes people say, well, actually we were thinking of putting this on the market, would you consider this? So there's yet further discussions to be had on alternative locations, but it's a point in time where those are the 2 at the moment that deliver the highest scores on our criteria.
Yeah, that's rather concerning from my point of view, I must admit. This council did pass a motion last year that their preferred option would be a new hospital on a site that would be, well, comparatively easy for West Berkshire residents to get to by public transport, and those 2 sites don't really fulfil those criteria. Yeah, thank you. I believe that John Ashton has a question.
Hi, I'm sorry I was late and I couldn't find an invitation, so I missed the bulk of the presentation, so I may be out of order, but I just wanted to ask whether in working up these proposals for hospital rebuild, there's been an options appraisal for capital investment that optimizes integrated care across community care, primary care and secondary care, rather than automatically defaulting to rebuilding the hospital. To have a whole systems approach to keep people out of hospital by strengthening primary and community care, ensuring everybody has access to a decent health centre, more community beds, and so on. Has there been an options appraisal, or has this just started from the point of view of just rebuilding the hospital?
So the answer to that is yes, and that's being done as part of the clinical model work. So we're working both within the hospital on what services could be located in different places that are closer to home for people, or closer to local communities in our population. We have moved some of those services to different locations as well. So you'll see we're using Townlands and West Berkshire more. We've had some diagnostics go to Berkshire, for example, recently, and to Bracknell. So we are utilising more of our other sites as a start. We are working and talking with primary care colleagues on a regular basis around what our model could look like, working much closer with primary care. And we have a work stream in the programme that looks at, should there be options in terms of builds around that integration, that we have some resource or a team to explore what that might look like in reality or in practice. So for example, if we move services, where could we move them to if it's not our current sites? How much would that cost in terms of capital? How much would it cost in terms of revenue and running additional sites for our staff? Would they need to come back and forth? So there is a work stream looking at those, and actually the new hospital programme confirmed to us recently that they encourage using the resource not just for hospitals, but if there were supportive of clinical models that have integration, they would be supportive of using funding to, if it delivers best value for the community, to use it in that way. So there is a work stream on that, and but we haven't got options firmed up as yet on that, but we are working through those options.
And could I just, as a supplementary then, is part of that to have your own primary care centre in association with the hospital?
Our own primary care, so Janet might be able to answer some of those questions in terms of the discussions with primary care, but that's not something that's come to me to scope up in terms of the build.
No, this is, I was part of the new care models work with Simon Stevens' team, and we were looking at different options for the future. And one of those is actually, to include having a primary care associated with the hospital, so that people aren't using A&E unnecessarily, but also, people who've got difficulty in accessing a GP are able to get access to a GP through the primary care centre provided by the hospital. And also there's the option there to develop occupational health out of a centre like that to serve the needs of the hospital community for occupational health, but also to offer occupational health services to small and medium-sized enterprises that don't have occupational health, which is a problem in this country.
Shall I come in there? So potentially, yes, we're not discounting anything at the moment. Obviously, a number of those options, John, would actually increase the footprint of the new hospital. So yes, all of that is on the table, and that's why we've got a big work stream around the clinical services strategy, which isn't just about us as an organisation. It's absolutely how we interact with primary care, with the voluntary sector, and obviously with the local authorities as well. So, yeah.
Thank you very much.
Councillor Codling.
Part of my question, I think, has been answered, but it was very much following up on what Alan was asking about location. Does it just actually have to be one hospital, or could we further develop the West Berk site at Thatcham and a smaller site in Reading or Slough or wherever, and have more services this end of the county?
I think just to reinforce what Janet's just said is absolutely those are the discussions that we are having. There's nothing is off the table. Some of this has to be worked through in terms of, you know, affordability more than anything. But yeah, I mean, we are expanding what we're doing at West Berks. That's what we've been doing recently. So it's absolutely, that's part of the clinical model discussion that we're having. And when something concrete is proposed, we run through those costs and options. Oh, sorry, dog's gone off.
Thank you.
Are there any other questions, please? Thank you very much, Alison. Very informative, somewhat alarming in some cases. Thank you.
Can I just ask how you would like us to continue to talk to you about this? So, you know, are you happy if we say when we've got something new to tell you that we come back again? How would you like us to carry on working with you?
Oh, yes, please. I mean, it's such an important issue. I think we could, in fact, even have a special meeting if necessary. If it, you know, when something really. If there's a really major event happening. Sure.
Okay. We will definitely keep you on our list of people to talk to regularly.
Thank you very much. Thank you. Could we then go on to item 9, which is the Berkshire West Place-Based Partnership update. Bit of a mouthful.
Thank you. Thanks, Chair. So I'm going to take the report as read and pull out the key points for members' attention. So there's a long history of partnership working in Berkshire West, and I think with the formation of the ICB, which happened on the 1st of July last year, obviously, and the appointment of the place director, Sir Sarah Webster, it's really driven both a stock take and a refresh of our place-based partnership, which is the unified executive. So as the report mentions, there have been a number of, there have been workshops, and after gaining a steer from the chief execs and confirmation of a continued commitment to work together, a subgroup was tasked with developing proposals really on the form and function of the place-based partnership going forward. So within the document, a refreshed and revised governance structure, which I think is shown in 5.9, seeks to balance the place and the local authority footprint in terms of how the governance is working. It aims to be agile. It has removed quite a significant amount of duplication. And what we're really keen to do is actually show that very strong link between the unified executive and the health and wellbeing board. So as partners, we've developed a set of commitments to set really the tone and the expectation for the partnership. We've refreshed the Unified Executive Work Plan with a set of priorities identified as being key areas for joint working. I think that's actually shown in section 4. So the programmes are at various stages of maturity, and a paper will setting out the progress on these will come to a future health and wellbeing board. So that's where we've got to in a nutshell, and I'm very happy to take any questions.
Thank you. Are there any questions, please, from members? You appear to have got off lightly. Thank you. Thank you very much.
Thank you, Chair.
Can we move on then to item 10, Better Care Fund Year End Report? I invite April Pebbody to present the report, please.
So hopefully again, have any people. Sorry, I'll start again. Hopefully you've had opportunity to review the paper on the report and had a chance to also look at the actual report that we sent back. So the purpose of the report is to share the Better Care Fund end of the year report for 22-23 and also the Adult Social Care Discharge Fund end of year report for 22-23. Both reports have been signed off by the chair of the Health and Wellbeing Board. The Better Care Fund, just as a bit of a recap, is a national vehicle for driving health and social care integration using pooled budgets. And the Adult Social Care Discharge Fund was announced in November 22 to tackle delays in discharge with discharging patients who are fit to leave and free up hospital beds. The two funds have been pooled and we have a requirement to explain how the funding has been spent and the impacts, and that's what we report back on. The report provides feedback on the 4 national metrics. So I'm just going to refer you to 4.5 in the paper. So generally, I think we can say that our performance has been reasonably good across the metrics, but not so good on one of them, which we'll come to. So in terms of avoidable emissions, we have continued to perform well in this area and on track to meet our target on the end of year position was 539, against a plan of 539 was 521. Percentage of people discharged to their normal place of residence, we were on track to meet that target. Residential admissions, so we didn't do quite so well on this one. There has been a bit of a challenge with this. We saw quite a huge spike in May 22, which we believed was a result of some of the COVID funding, because COVID funding was there to really promote that fast discharge from hospital. And we think that the domiciliary care market wasn't so strong during this period. So we did see an increase in our residents being admitted to care homes. So that gave us a bit of a spike in May. It did come down again then after that, but it was very difficult for us to then get back on track to achieve that target. But as I say, that position has stabilised now. Reablement, we've performed well in this area and on track with our targets. So just moving on, I think there has been some really good success, some great system working, and there's some examples there in 4.10 where we've done some really good work and worked well as a system very quickly, really, to achieve some really good results. So the impact of this funding was that more hospital beds were available for those that needed them, and people were able to recover at home or in residential care instead of spending too long in hospital. So hopefully that provides a summary of the paper. I have delivered this paper on behalf of Maria and Paul, so if you have any questions, I hope I'll be able to answer them, but if not, I can obviously take those questions back to Maria and Paul.
Thank you. Councillor Lewis.
Morning, April.
Morning,
It's a question really regarding a personal experience, which has made me think on a wider scale. With regards to the item 4.5, and it's the number 2, percentage of people discharged, is that ever reviewed to see if those discharges were successful? For example, did they have to go back into hospital because they've been discharged too early? I've got big concerns regarding that. If they're trying to meet targets, are people being sent home too early, which will impact on all the services again?
I think there's, and I'm not an expert in this, but I think there is a measure. I think that's what the measure is. There's around how long they are staying at home and not being discharged back. So I think that's what one of the actual metrics is around. So I think that is very closely monitored, because obviously what we wouldn't want is people being discharged too early and then coming back into hospital. So there's a lot of work to try and avoid that happening. But if you need more detail on that, Councillor Lewis, obviously I can provide that for you.
Yeah, I think just as a supplementary on that, it would be nice to have more clarification, because I read that or interpreted it as being people are in hospital, then they are discharged, and those current stats are provided on that element. Whereas I'm quite concerned with the bit afterwards.
I think there's a 91-day target, if I remember correctly, and that's what we're measured on, that if people staying at home and not coming back into hospital before that. So.
And if I remember correctly, that looked reasonable, but that's a while since I looked at the numbers.
Yes.
Thank you.
Thank you.
Thank you.
Councillor Stewart.
Thank you. I don't know if there is some language that's used in this report, as with many health-based reports, where for anybody listening that isn't used to the language might be unsure. So there was something that I wanted to say in particular, which is probably feedback back to Maria, which I'm happy to share with her when I meet with her next week. In 4.7, on that same page where we're talking, there are quite a lot of, there's a breakdown of where money is being spent, and it talks about things like CHS project and PMO and things like that. PMO to me means Project Management Office, but I don't know if that's what it means in this context. So I think it would be good if we can make sure that those are clarified in future in this report. The other one is in under 3. So residential admissions is something that's always been a concern for me when I was portfolio holder, because this is where a lot of our money is spent in terms of people that need to go into residential situations. And there is a line in there which talks about the trusted assessor approach. And I don't know whether you can explain for anybody that's listening or watching what that trusted assessor approach means, because that is quite a key part of decision making around whether people can be admitted, should be admitted, can be released, all of that sort of thing. So it would be good if you could explain that.
So I don't know that in detail, but I think part of that process is making sure that before people are sent home, that they are assessed properly to make sure that they've got the care and support to support them if they go home. And so that process is very important, because clearly if we don't do that in detail, then people could end up going home without the adequate support. And then, as we say, then that would affect them then subsequently coming back into hospital.
And that would include things like the dom care that you're talking about, and making sure that the right care packages are in place. So those decisions need to be made quite early. I think there is something to be investigated a little further in that process, because at the moment we talk about integrated healthcare system, but of course there are still challenges around funding and who funds what part, and whether each party has the funding to do it. So I think that I believe there is some work that needs to be done further in that respect to make sure that funding issues are not tainting the decisions that are being made, shall we say, because obviously it's absolutely about the patient or the person that's being released. It shouldn't really be down to any other decision, should it?
No, absolutely. And I will take that back to Maria. Maybe we can provide some more detail on that process at the next meeting for reassurance.
Yeah, that would be great. Thank you.
So I think John Ashton next, and I'll come to you.
Thanks. Well, this sounds encouraging, but I think what's important with this whole area is to make sure that the emphasis on getting people out of hospital is accompanied by an emphasis on not admitting people to hospital. And otherwise, you're in the same kind of situation as building more motorways. They just fill up with cars as soon as you finish them. The empty beds just get filled up straight away, not necessarily appropriately. So I think that the Board of Health and Wellbeing should be framing this in a future-proofing strategic way, which means we have to talk about housing, planning, investment, and supporting communities, and joining up with the conversation we just had about integrated health care and hospitals and primary and community care, so that people are kept out of hospital as much as possible. And then secondly, that whenever anybody is admitted to hospital, the discharge plan starts to be put together on day one, so that you don't get to the point where people are ready to go home, and then only then do you realise that they can't go back to the house they've come from because it's no longer suitable. So it's my belief that there should be somebody from the housing sector on each hospital board to be able to have those conversations. I think, planning decisions about new housing investment is really important, because people can stay independent living longer if you have the right kind of housing in the right place in neighborhoods where people have lived their lives. So I just want to make sure that we're doing that. We're having a whole systems perspective and not just focusing on getting people out of hospital. So are we doing that, or are we not? I'm relatively new to the scene here.
Can you respond to that, April?
I think it's really, really good point, John, and it's a good challenge to make sure that how we're actually linking everything up, and specifically in terms of public health and the prevention work. I suppose I would refer in the report as one example in terms of the Be Well This Winter campaign that we did. We worked as a system to put a project together over the winter period to really help support our residents, making sure that they had relevant information and support during that period to try and prevent people coming into hospital. And part of that was about giving all sorts of advice in an outreach way to our residents, but also giving the COVID vaccine and a whole sort of programme of activity around also trying to inform our residents about where to get the right help and when. So that I know that's not the answer, and there's a much more bigger scale that you're talking about, John, but certainly that was something that we were really keen to do this winter, and it was very successful and just showed really good partnership working, I think, across the system. So that is an example.
It is only part of the answer. I mean, in 1948, when the health service was created, it was the Department of Health and Housing, and the linkages to housing at the local level and housing planning, where there's new build going on, or regeneration and so on, this needs to be joined up. I'm afraid historically the NHS has been very poor at linking into the housing sector, and the local authorities haven't been particularly strong with their links to the NHS either. And the Board of Health and Wellbeing is the place where these conversations need to be joined up. So I just want to flag that up, really.
Thank you. On the issue of kind of preparing for discharge, we do place social workers in hospitals so that planning can start some time before the patient is actually discharged. The other thing on the issue of housing suitable for people who may be not well after, shall we say, or disabled. In our new local plan, we do have a policy that 10% of new homes should be wheelchair accessible. However, the planning inspector has questioned what the evidence is to base that figure on. So we're starting to get there, but there's a long way to go, I think.
Yeah, but the Lifetime's home standard is one which has been available and around for a long time now. It's more difficult to implement in some places, particularly rural communities with old agricultural housing and so on, but it shouldn't be a problem to do with new build in more urban areas. But the other thing is that as a leader of opinion and culture, each borough needs to be encouraging people to think about their housing needs for the last 20 years of their lives. I mean, from post 60 probably, because what happens so often is that people don't make that move into more appropriate housing for later life, and then an admission to hospital causes a crisis because they can't go back to where they've come from. And you know what better healed people tend to do is to move into an apartment or something where they're on the level and they don't have to go upstairs to bed at night because they're on the level, and you know, they're going to have balls and all of that. And we really need a community-wide discussion to raise awareness about why it's important, once the kids have gone, to start thinking about what your housing needs are for your later period of life. And that requires the leadership of, I would suggest, the local council to lead that conversation.
Thank you. Heike.
Thank you, Chair. And I would like to give John some reassurance that in Berkshire West, we've done a lot of work on that sort of information sharing and outside of hospital work, keeping patients safe at home. So not just about avoiding admission, is keeping you safe in your place and sufficient care, and working with the hospital. So I'm sure Janet will agree about how much work we've done at the front part of the hospital, and how that planning for discharge starts at the start. The other point I'd like to make is echo what Councillor Lewis said. I think that element of discharge or failed discharge, we need to keep an eye on. So April, you know, when further reports come in, if that can be commented on specifically. Two other points regarding discharge to care homes, and I know we saw that little bit of a spike there, but I think sometimes a discharge to a care home is a safe discharge. That patient has 24-hour care, and it's that part that we're worried about, too early discharge to your own home, that in those wee hours you are not covered. So I don't see it as a complete, you know, a downside that was used more. And then my last point is probably a challenge to us as a health and wellbeing board, is how do we celebrate our successes better? Because that is what we need to take out to our patient population, you know, the success around reablement, that a higher percentage we are ahead of performance in keeping, you know, achieving your reablement potential at home. Because then us as, you know, our patients, our colleagues, and us, when we become patients, will have faith that the person coming in is going to help me because they help my neighbor. Celebrating the success and getting that message out to the people of the vaccination hub that became our crisis hub, the success of that, so that people believe in our initiatives that we take, and they volunteer and they want to take part and they tell their neighbors about it. So that would be my challenge to us as a health and wellbeing board. Thank you.
Thank you. Are there any other questions or points? Sean.
Thank you, Chair. Can I just really kind of add on the issue of housing, and to reassure John that the issue of housing standards is a very, very high priority in the council. Obviously, there's a lot of work goes on in my own team with environmental health around private sector housing. And there is work going on looking forward as well. So at the moment, we're in the process of conducting a housing condition survey across the district, which is something perhaps we could bring back to a future board. And then obviously within the housing team itself, there's a lot of work goes on around facilities grants as well. So it does remain one of the very highest priorities for us as an authority. There's always lots to do. We saw that this winter in particular, with issues around damp and mould, and that coming to the fore. But there is a very kind of comprehensive strategy to deal with basically poor standards in private sector housing.
Thank you. And
No,
I think
thank you for that. But I just think that any new house should be built to lifetime home standard.
okay. Thank Sean. I was just going to come back and say that I think that would be a useful report to bring back to this board. Thank you. Any other questions or points? Okay, thank you very much. I'd like now to move on to the response to the cost of living crisis, item 13. I'd like to invite Sean to present the report, please.
Thank you, Chair. Sorry, I'll just get to the front
Sorry,
page.
I've skipped tonight.
That's what threw me. That's what threw me, Chair.
Sorry. Item 12,
I'll stand down.
Delivery Plan Progress Report. Zoe Campbell, please.
Thank you very much,
Sorry about
Chair.
that.
That's okay. A refresh of the delivery plan has made positive progress in recent weeks. A task group was set up, and I would just like to say thank you for members of the task group and subgroup chairs for their engagement in that process and that work that they have done to update their actions. The original delivery plan consisted of over 150 actions. The first draft of the refresh has been completed and actions have now been reduced to just over 50. Many of those actions have been completed by the end of 22-23, and many are now reassigned and sit under a subgroup where they didn't previously. Many actions are also being reported through service plans and business as usual activity. There's more work underway on the delivery plan, as we would like to move more towards outcome measures for each priority that will enable us to see whether we're really making a difference to population health and against our priorities. That will also facilitate improved monitoring and reporting to the board. And this approach is consistent with the original intention for the delivery plan to be a living document. In parallel with that work, the steering group are considering how the subgroups can be better structured. So the subgroups were originally structured with the previous strategy. So that work is ongoing, just also making sure that we maintain the good work that has already happened. It's proposed that the steering group should continue to update the delivery plan over the coming months, and that the board should be kept up to date through a rolling programme of priority progress reports.
Thank you.
Thank you.
Any questions for Zoe? Councillor Stewart.
Thank you. One request would be, could we have the plan in its Excel format in future? Because I do struggle reading it in the packs, and there is a lot of really good information in it. So that's just a sort of a housekeeping issue. It may just be me, but I certainly prefer to read the actual document itself. The other thing that I really welcome, and I know that Councillor Lewis and I have had conversations about subgroups. I really welcome looking at those subgroups. In particular, the one that I'm involved in is the Mental Health Action Group. And I think now is absolutely the right time to look at the role of that subgroup. It may be that some of what we learn from doing that would also affect or help or assist and shape the other subgroups as well. In particular around resourcing, responsibility, and the empowerment that I guess that group has, because I think we found that quite challenging. So I think there's lots of good information and feedback that we can give into a review. So I guess what I'm saying is I haven't yet had the opportunity to say that to anybody, but if there is a review going ahead of that sort of those subgroups, then I'd really like to be involved.
Thank you very much. Noted.
Councillor Lewis.
Thank you. Thank you to Councillor Stewart for picking up on that. It's something I'm quite passionate about with that group. It has the title of Mental Health Action Group. I have a frustration. I've only been on that group for a month or so, but the frustration was born out of the inactivity the group have. They're not able to proceed any further. So at the moment, I just feel it's a place to scribe, take note, and then not be able to do anything. So we really do need those boards reviewed, specifically around them being able to push forward with some of those ideas, almost like they are a committee in its own right, with accountability.
Thank you very much, Councillor.
April.
Thank you, Councillor Lewis. I was just wondering, in terms of what you felt the barriers were, because I think that's quite useful to get the feedback. So in terms of, so the ideas are there, the discussion's there, but do we know what the barriers are? Because that, I don't know, just start out of Councillor Stewart, because you go as well to that group. So I don't know what in terms of, so we think that there's discussion, but difficult to get that then into action.
I'll start, but I know that Councillor Stewart will be able to add into this. So for me, I was noticing we have some charities on board, excuse me, who want to get more involved, but they're restricted by resourcing, by funding. They're coming up with some really valuable data. At the moment, we can't action on that data because of funding. And a lot of things have to put in a paper. They then have to go forward to another group to be looked upon. So there's the whole timing issue. If we had some more senior representatives on it who can actually give some direction to encourage things to go through a bit more speedily, that would also be welcome.
Do you want to add to that?
You've put that beautifully after only a month. Yes, I think that, and I think also the reason I said about this being the right point in time to review it is that we've had changes in people coming to the group and not coming to the group. So I think a refresh of the responsibilities so that people themselves, whoever attends, understands why they're there. Because we've seen some of those people drop off, and it could well be, and there is, you know, perhaps a feeling of apathy. People have, you know, such a lot to do in such a short space of time. They don't actually want to feel like they're wasting their time in a session. I don't think they are, because when we listen to what they're telling us, it is really valuable. But as Councillor Lewis says, if it doesn't then go any further, eventually people go, well, what's the point? I would just like to also stress we've got some brilliant officers working with us in that action group. But I do think also we've got one of those, again, it's that challenge of so many different partners. So we have the voluntary sector, obviously, who is so vital to what we're trying to do. We have the healthcare services as well, also extremely vital to what we're trying to do. So we've all got slightly different languages, but I think we're getting through all of that. There is definitely a want to do something, but a little bit of frustration about how we actually get it done.
Thank you both. That's really useful feedback, and that's something that we can take away and think about how we might be able to help with that and tackle it and hopefully come up with some solutions. But yeah, it's really helpful. Thank you.
Sorry, could I just ask, has anybody of any of the other subgroups sort of made any sort of noises about their challenges? Are we the only one, or that would be good to understand?
Yeah, no, I don't think so. And interestingly, Zoe will be able to say a little bit more about that. But the Ageing Well group have got a session at Shore House, I want to say on Monday morning, just to meet together and to talk about how that group is going to be taken forward. So just having that space, an opportunity to have a bit of an open discussion about that. But Zoe, I don't know if you would like to say anything else on that.
Yeah, I think it's really important for us that we had experienced the same thing and some partners had dropped off. And I think as we're bringing everybody together and they'll all have the opportunity to contribute and come up with actions that we can all be a part of delivering. So that will hopefully be a really useful process that we might be able to, that we can share with you.
Thank you. Are there any other
So just a supplementary in all of this, going back to all the subgroups, do they feel that they are still part of the Health and Wellbeing Board? Are those people asked to come here and present, to give updates, feedback? I know we all read the report, but sometimes when everyone's in the room, you can get a bit more interaction and understanding of what's going on, and especially the challenges. How many of those people are coming forward with the challenges of the subgroups? I don't know whether people feel they can share their frustrations or whether they think this is a forum for them to be able to do just that. I mean, I'd welcome hearing more about what people are doing, because it's sort of, it almost acts as a ripple effect where we can all think, oh yeah, okay, we can learn from that as well. I'm just wondering if we're making good use of this particular board.
I wondered whether that might be something that we could move towards as we have our rolling programme of reports. At the moment, under each priority, we've got actions that sit with multiple subgroups, but as we develop the outcome metrics that will hopefully be owned by the subgroup, then perhaps the chairs could come to Health and Wellbeing Board and present the updates themselves, and that should help.
That sounds good, actually. They seem to be a little bit divorced at the moment, from my limited experience. Thank you.
We can improve that.
April.
Thank you, Zoe. And I think that's another really good question and challenge. And I think something that we did used to do, and we've spoken a little bit about this, Gordon, myself and Zoe, prior to COVID, we used to have hot focus, I think they were called hot focus sessions, where all the board members would be invited to meet with the steering group members, and then we would have a focus on one of the groups, and they would give an update in terms of the work that they were doing, raise any questions or challenges that they might have to board members that then might be able to help with that particular challenge or area, but just really focusing in on what they're doing so that all the board members have a better, greater understanding of the work of that group. So we have talked about that, and I think that would be quite helpful. I used to really enjoy it because you'd hear in detail what the other, over time, what all the different groups are doing and what they're focusing on for that particular year. And that then used to sort of culminate in the conference at the end of the year, where we would share some of the real sort of highlights from each of the groups. So I think it would be helpful to get back to that sort of mode of working, if obviously only if the board is in agreement with that approach.
That sounds very, very sensible. The other issue that's come up recently is whether early years are adequately represented. There seems to have been a change, and people think that they're not being represented. So perhaps there's something else we can look at. Okay. Any other issues, points? Thank you very much, Zoe. Move on to you then again, Sean. Sorry, I missed something. Sorry.
That was like 11.
Oh, I've done it again. Sorry. So the item 12, the delivery plan report.
Thank you, Chair. It's me again. So this is the first of the rolling programme of priority progress report. So this is on priority 1, reducing the differences in health between different groups of people, and that has a focus on opportunity, outcome, access, and the impact of COVID. Good progress has been made, and a number of actions, and members are asked to note those at 4.7 and 4.8 of the report. Further work is underway, as I've mentioned previously, to move forward and progress actions and develop additional actions. And some key areas include focus on cardiovascular disease prevention and outreach, embedding health in all policies within the council. And this report seeks to provide assurance that to the board that those actions are being delivered on and updated. Members are asked to note the actions and to consider whether they are appropriate, also to commit respective organisations to delivery.
Thank you.
Thank you.
Do members have any questions or comments, please? Councillor Stewart.
I'm just trying to find it because I know I've put lots of little notes on here and currently can't find them. But I think I'm right in saying that, particularly where we're talking about health inequities and inequalities, some of the actions that say that they are closed or indeed moving towards business as usual, I wonder whether we feel that I'll explain myself better. So EduCafe in particular is mentioned quite a lot in terms of some of the fantastic work that's been done in terms of bringing communities together. But that's very Newbury centric. And we've got a huge district that there are other people that will, from hard to reach communities, that will not have been able to access those services. So I guess my question is, I completely understand if we think that a particular line has been, yes, we've managed it here, and that becomes business as usual. But what about monitoring and measuring and making sure that we haven't missed anybody else, and that we are still continuing to do that work? I think I'm right in saying that if I was to talk to some of my Health Watch colleagues, they will say that when they talk to particularly people within ethnic minority groups, that they don't always feel that they're being heard or that they have access to the services. And that's also including rural communities. So it was just something that jumped out at me that said, yes, this is complete and for removal because EduCafe, and it actually mentioned specifically this is in Newbury. And I certainly know that my residents will go, well, that's Newbury. So it's a bit of a waffle there, but I do think we need to be cautious about saying, yes, tick, we've done that, and making sure that we don't lose sight of the bigger picture.
Heike.
Thank you, Chair, and thank you for the paper. So declaring upfront, I'm cardiovascular lead, not just for Berkshire West, but also for Bob. So I really welcome all the CVD prevention initiatives within this. And for me, one of the key things that, because that's how we're going to improve our morbidity and reduce our mortality. And I would like us to keep a measure of the impact, all these good initiatives, but I don't feel like we keep track of the impact that it's making. And I come back to my previous statement, then telling people far and wide, we need to tell our Berkshire West people, patients, this is good. This is why keeping healthy is important. And if you've had an event, this is how you stop your second event happening. Relay it to families, and this is the successes of this particular program. This is the successes of what's happened in your area, because building that trust in our initiatives and things that we invest time and money in is so important. How do we invest more in what's working well, and then be brave enough to stop what we should not be doing. But I would really like us to involve everyone around us in CVD prevention and selling the success of it. Thank you.
April.
Again, sorry, Heike, thank you. You do make some really good points, and Councillor Stewart as well. And I suppose to say that there is some ongoing work around health inequalities in West Berkshire. We've done our needs assessment, and our next step is to really try and look at the hidden inequalities. So in terms of what you were saying, Councillor Stewart, is to try and do a bit more work around that. So it's one of our sort of actions and something that we're looking to do community participation on, to try and really look at that, because it is important. And like you say, one action doesn't solve everything, and we certainly don't want to give that approach that we think that we've solved it with that. And I think it's really good to raise that. Like in terms of impact, again, I think this is something that we are really keen to sort of get better at, is to identify what the impact is, rather than just maybe measuring the numbers or how many times we've done something. We really want to get better at that. And I think that's a key thing that we need to drive going forward. The comms and telling people about what we're doing, I completely agree. I think it's really important, not only in celebrating our successes, but also in enabling us to to communicate well with our residents, to be able to help them and give them the correct advice and signpost. And we did used to have the comms and engagement group as part of the Health and Wellbeing Board. And I think it's becoming quite clear that we are missing that group, and we need to maybe think about installing that group again, but to have a discussion about how that group might work and what we need from it.
If I may, and just the opportunity around comms again, joining with the ICB comms, joining with the Royal Berkshire comms on key messages, you know, so there might even be opportunity of savings in joining on key messages. Thanks.
Councillor, could I just come back to something Councillor Stewart said? We do have areas of deprivation in Calcott, Lambourne and so on. So we do need to think, we can't be Newbury-centric. We do need to think, how are we going to engage people in those kinds of areas who are not going to be prepared to get to Newbury, and if they haven't got a car, it's difficult. So please remember that. Thank you. Councillor Lewis.
So just broadly speaking of all the things that we have been talking about, and again with Dr. Hyde, it's something we're not very good at, which is messaging and making sure we're always doing the positive spin and making sure we're accessing all the different ways of communications. Not everyone wants to read, not everyone's got social media. A lot of people seem to also view that everything is Newbury-centric and that the outside areas are forgotten about, so they switch off. As soon as they hear the words West Berkshire, well, that's not us, we're Reading, or we're Tilehurst, or all these other places. And I would welcome some almost like hubs, wellbeing hubs being set up. Perhaps every village needs to have a wellbeing hub where we can start sharing the celebrations of people in recovery, all the good news things, and also come away from the stats and the figures that to me just turns people off. How else can we identify a person's pain or a way to connect with them? So, for example, if you were saying to a child, don't kick, the last word they heard was kick, so they're going to kick. If you said, keep your feet on the ground, they're going to hear the words ground, they're going to keep their feet on the ground. So if we were saying to people, oh, don't eat junk food, they've just heard the words junk food, so they're probably going to eat more of it. So the point I'm trying to say is find the connecting button for that person. How will they respond to messaging? Another way of putting this across is if someone was to say to me, if you exercise more, that's going to help your heart stay safe and healthier. Okay. But what's that investment as well worth for me? It means that you're going to live a little bit longer, you'll be around for your grandchildren, and all those other positive aspects. We're forgetting that element of it. We keep harping back onto the maudley stuff, almost, you know, the death, scary stuff. And that's when I personally would switch off. I don't want to hear anymore. But tell me about the good stuff. How else am I going to enjoy this? And I think that's the piece we're missing here as well.
I would hope somebody's done some research on those kind of messages. Sounds like an academic, useful academic thing. Thank you. Just thinking of the, I can't remember where I've seen it now. There's something about health and wellbeing hubs being reported in one of the reports I've seen. I can't remember which one it was, but perhaps a step on the way to that would be to build on that with that health van on the move thing. So if we, because that seems to have been very useful, but the issue I had with it was it would do COVID vaccinations, but I don't think it did flu vaccinations. Why not do both at the same time? And also it would signpost people to getting a cardiovascular test done. And then you're saying, well, okay, now go somewhere else and get that done. Could we start thinking about whether we could get all these kind of things done all at the same time in one place? And I think we would make I think that would make a great deal of progress if we could do that. Thank you, April.
Yeah, absolutely agree. And I think what we're realising more and more in public health is this whole thing around community outreach and how important it is. We can't expect people to some, you know, come to places, we need to go to them, and we need to deliver joined up approaches. And I think that was what was good about the Be Well this winter, that we really did have a think when we go out, what are all the messages that we need to take out, not just focus on one thing, but just think about a sort of raft of things that we can take out at the same time. And certainly something that I'm really keen to do as part of my role as service director for community, interim service director for communities and wellbeing, is to look at the assets that we do have, and we have our libraries in the communities and our leisure centres, and how we can join those things up together. We have Shaw House, we have our museum, so wherever we go, how do we link health into those people's visits so that we can provide information, the right type of communication. Councillor Lewis is really important so that we're not switching people off. But the libraries are an excellent example of where we could be doing that work around health. And we are really starting to engage with our libraries and having conversations with them about that, and seeing how we can sort of really work effectively to draw things together.
Thank you. Councillor Stewart.
If I could add to that, parish councils as well, because I know that Tyler's Parish Council, I talked to them about them potentially opening up some of their buildings for as a warm space in the winter. But also they have recently started an over 50s club, trying to reduce isolation and have somewhere for people to come for, you know, drink and snacks and play some games and have conversations. And I absolutely agree with you that that community piece and building as well on what Councillor Macro said in terms of people not being able to get to perhaps a central location like Newby, but they may be able to get to their local parish council building. And I think that's really valuable.
Councillor Codlin.
I'd echo that. In Chieveley Parish particularly, they've got a very active group, and they have a men's health, a very good village hall where they use quite a lot of things like that. Linked, admittedly, they have the surgery in the village, but it is linked to that. And they have other groups. They also do a warm space. They did over this last winter, and they're planning it again for the next. So, you know, the smaller community hubs can be quite useful. In Cold Ash, there's a Friday afternoon meeting in the room attached to the church, where people are given lunch. You just turn up, you don't have to book. So those community facilities make a huge difference.
Thank you. Councillor Lewis.
And just taking this subject a little further, with it, I've called it community hub rather than outreach, because I associate that with a negative. It's just the way my mind works. These are all brilliant places where you could have all these hubs. They're resources that are already there, and we don't have to spend that much money to do it. So if we don't have a mobile unit, which costs money, and I know that we would have to consider replacing probably some of them because they've aged. You've got these places, including village halls as well, but we're starting to rebuild communities. That's something that we have lost. That whole aspect of well-being, mental health, that can all be improved if people feel like they're part of a community. We've just all become so isolated in our own homes and in little boxes. It would be lovely to get it going. So again, with the over 50s club, that's somewhere where they could be having their teas, coffees, and we could just have boards that are up and around with some messaging. You can have people visiting. Could be people from, I don't know, something like a WI group might want to go along and talk about their experience about how they cope with COVID or bereavement, all these different people that are out there in the community that will be there to help. And that's what I would really love to see, is the community coming back together.
Thank you. John Ashton.
But yeah, this is a refreshing conversation. I mean, it sounds from the way people are talking that there isn't really currently a strategy for the villages and parish council areas. I mean, those kind of strategies do exist in other parts of the country with village plans and village health plans and healthy village initiatives. I mean, historically, of course, the church was the focus for all of this, but now that that's no longer the case, it is a question of being systematic about identifying which where can be the focus for this, whether it is a village hall or a pub in some cases. I mean, you know, the King, as he now is, has a place at Heskett Newmarket up in Cumbria that is now a village hub that does lots of different things from the pub, including the post office. You know, but we really need a strategy for this, and we need to work with the existing. This is where public health's got a part to play, but it's by no means everything. And I'm just wondering how the Board of Health and Wellbeing might progress this agenda, really, because it's a nice project to bring everybody together.
John, do you have any good examples of those strategies or plans you could share with us?
I'll have to go and think about it, but I live in Cumbria. They did produce, everybody was involved in this about 10 years ago or 12 years ago, that we all had this process in Cumbria for village plans. I imagine the LGA would be able to help there, but you know, I think there's no reason why we can't just get on with it. Start a conversation. Parish councils are a variable feast. I mean, some of them are very good and some of them are not so good. You know, I think it's horses for courses, but the conversation which we've just been listening to is saying some important things. And if there is this, you know, and what I detect as an outsider here is there's a lot of concern about Newbury getting more attention than other places in West Berkshire. And this is a way to balance that up. If there's an explicit effort made to develop local plans. Hubs, I mean, the government are funding various hubs, family hubs and women's hubs. There's been money from the Department of Communities and Local Government for things. I don't know where we are on that in West Berkshire, but hubs are where it needs to be. Hubs in one kind or another. I mean, health centres can be hubs and community schools can be hubs. It's a question of mapping and seeing what you've got and where the leadership lies, who's prepared to get stuck in. So I think those are my thoughts on this, really.
Thank you. Any other issues or points? Councillor Stewart.
I was just going to say, we've got district parish conference that I don't know when the next one is booked, but maybe this is an opportunity to have conversations at a parish level to see whether there's an appetite, you know, to hear about what they're already doing. So maybe we need to actually find out what our base level is, where are we now, and then work out, you know, what strategy we need perhaps to develop further.
That's a good point. Yes. Thank you. Okay, so we don't need to vote, but noting the report and the progress made. Do we still consider if the actions are still appropriate? Yeah. And do we agree which ones should be referred upwards to the place or system levels? Okay, thank you very much. It's going to be move on to Sean. Sorry for the two false starts.
That's no problem, Chair. In fact, actually, the debate at the end of the last item really is where I think this paper that I put before the board today kind of takes us, you know, about how we deliver services and where we deliver services. I think is the critical question going forward. So just to return to the substantive report, if I may, I mean, clearly, probably there's very few words that define the last 12 months more than the words cost of living. And back in September last year, this board decided that it was something that we needed to have a look at, given the rapidly emerging increases in the cost of living and the potential effect on residents. There were obviously some predictions which didn't come to fruition in quite as significant a way as was talked about, particularly around energy prices, when I think there was talk of £5,000 and £6,000 price caps. But nevertheless, there were substantial increases in energy costs, and obviously some of those were offset with some of the national interventions. But looking at what we did locally, we did go away after that board meeting, and we kind of got ourselves together and had a very good look at what we could do. And we did take forward a number of initiatives. I mean, the first of those that was set up very quickly was there was the cost of living fund that was set up jointly between the council, Greenham Trust, and became an appeal fund, with the view basically it was £50,000 pump prime from both, with a view basically to providing support, not directly to residents, but to the organisations that were there to support residents. And the details basically of where some of that money has gone is in Appendix A to this report. And there is still funding there available, which and grants are still being given out. And in fact, one's been given out since, one's been approved since basically even this report was written. Secondly, we went away and we talked to the existing voluntary sector partners within West Berkshire to look at what we could do basically as a local authority to help facilitate bringing the local response together. And the conclusion we came to was the cost of living hub. And when I talk about the hub, I'm not just talking about the couple of people that we had taking calls and providing advice and doing the referrals and signposting, but also the plethora of information that was made available. So some of that is set out in the toolkit in the appendix. You can see some of the key messages there. But also, obviously, there was a comprehensive amount of detail on a website, but we were very, very conscious that websites aren't the solution to everything, and we were conscious that we needed to get information out in other ways. So we also set it up a coordinating group. So we had an internal coordinating group, which April and others were involved in. And then there was an oversight group involving the Volunteer Centre and Greenham Trust, just to make sure that basically we were coordinating. So the key parts of this, I suppose, really were the cost of living hub itself, which was accessible via email, telephone, web form, and there's details in the report of some of the partners that were involved in that and some of the work that it did, and details of the numbers of calls and things like that it took. There was the Household Support Fund, which was managed by the council's housing team, which last year made, out of the last tranche, made 1,975 awards. And there was also within that basically funding allocated to free school meals during the holiday periods. There was the community warm hubs. Now, the community hubs, I think we've moved in terms of the discussion, and we've had an ongoing discussion with the people that organised those hubs and the success of them and the purpose of them and what they could be purposed for in terms of going forward. And there is an evaluation basically being undertaken now or very shortly. I've certainly seen the survey questions about what people would like to see in those spaces in terms of service delivery and in terms of information. And then obviously there was the Be Well This Winter work that was commissioned by April and the public health team. There's an evaluation of that. But I think from my memory, I think that the biggest topic even on that was cost of living, wasn't in terms of issues that came to that service. And then finally, obviously, we covered it in the Health and Wellbeing Conference. So just moving very, very quickly, conscious of time, onto the issue of evaluation. So we did actually contact the people that had used the hub, and we did get a number of responses, and there was some things in there that I think I've set out in the report that were interesting. So one of the ones for me that really stood out was that 70% said they'd never had a reason to contact the council about similar issues before, and I thought that was a very significant point. Obviously, the issues around the household costs and food costs were significant, but also the fact that 27% of those that responded declared themselves in some form of crisis. the point of contact. There was work done in order to try and get information out about mental health with people as well, and information was sent out to people that contacted the hub. There are a number of observations that I've included in the report, but actually I think that tells a picture of some of the kind of calls that were coming in. I've set out in the report, I did ask the people that were involved in providing the advice, basically for their observations. Quite often people who are doing the actual job don't get asked, so I thought I would ask them, and I've included those. And again, basically what was interesting and the one that stuck out for me was actually just how long these matters took to provide the support and unpick the issues. And actually, which leads me really to one of the things that we haven't really been significantly able to evaluate at this point, but would be really interesting to know, because I suspect a lot of the value, whilst there was value in the signposting and the referrals, I suspect there was a lot of value in the conversations that was had. And that leaves us back on really when we talk about going forward, about how we continue to have those conversations with people to be able to meet the needs of the community and to support them with their health and well-being. The report just talks a little bit about the current position. So I asked the voluntary sector for the current position of where we are. That's all set out in the report. I won't go into that. Clearly, at the beginning of the report, I've alluded to the fact that there are still challenges out there. Energy prices have come down, but they're historically high compared to where we were just sort of 15, 18 months ago. Obviously, we're in the summer now, but winter will return, and obviously, basically, that will cause challenges. We saw that this winter with some of the inquiries that we had around damp and cold homes as well, obviously highlighted by the tragic events with the toddler that were reported last year. Food prices, everybody knows that food inflation, food feels historically, it feels very expensive. Grocery prices are going up. Inflation itself is coming down as has been suggested, although perhaps slower than was expected. But and then you've got issues now around interest rates, which will eventually cut through into the rental market and increase housing costs. So I'll stop there. I just wanted to bring to the attention of the board the work that was done, some of the kind of questions that we're now asking ourselves, where do we go with all of this? And I'm happy to answer any questions.
Thank you. Councillor Lewis.
Okay, thank you very much for that presentation. I actually enjoyed reading this paper. There was an awful lot of blurb to go through to find some great reasons to celebrate, just going back to the point we don't celebrate enough. So, for example, item 4.18 and 5.3, so that includes the what the impact has been on them for having the hub, and 5.3, of course, was highlighting the observations of the users of the service. Has that been capitalised on to help others understand that the council is not the big monster that sits in the middle of Newbury, for example? Can we make that messaging positive and get it out and include it in everyday conversations when you've got people, not just officers or the people delivering the services? Could they even be seen as snapboards going up, which could be in the way of pop-ups or something that goes up on the walls, A4 posters, for example. And then just going back to the referral figures, in 4.12, you talk about actual figures, and then in 5.2, you give percentages. Are those all part of the same group of figures?
Just on that latter point, if I may, Chair, the percentages are 5.2 are the percentages that refer to the responses to the survey. The figures that relate to the number of referrals at 4.12 are the actual numbers of referrals in. So effectively what we're saying at 4.2 is that actually some people, 28 people that came for support to the hub, were referred by children and adolescent services, but actually 519 of them self-referred themselves, so effectively they came directly to us. Just going back to the point about celebrating the success of this and how we do that. I think we have been very keen and we have pushed the point that this was very much a whole community response, and this was the council working with many other partners to deliver this. And I think that was one of the real strengths of this. I mean, I certainly certainly in the process of managing the hub element of this, felt that actually there was a real cohesion in terms of the delivery locally. And as April knows, because I was on the panel, the board, that working group, sorry, that April was chairing, there was a feeling on that working group that we needed to do everything basically to build on that, wasn't there, April? But whether we've actually gone out and deliberately, sold the success of this, we need to go away and look at how we do that basically, and that there is an opportunity if we're going to provide something going forward for a platform for doing that.
Okay, and then just further on from that with those figures, it was wonderful to see, in fact, that a lot of people had self-referred. Has work been done on where they saw the information? What was the signposting that worked for them? And I noticed that Citizens Advice Bureau was quite a low number. So either that is because people don't want to go to Citizens Advice Bureau. Do we need to do some positive messaging around that? Because they're really good at signposting to everything that we offer. And then a final point to make is on 4.21, you've got the line in there, making every contact counts. If ever there was a line that was important to see and to take forward as to why community hubs are essential, that is it. Every contact counts, and it doesn't have to just be about the element that was being discussed at that point in time in the hub. Just think of how many other of our the services we provide could also be a part of that and heard and seen all at the same time. Thank you.
That reminds me of the make every message count, wasn't it? There's a very similar kind of message on the be prepared for winter campaign. Yes, thank you. Sorry, sir.
Chair, could I just come back on that last point? I couldn't agree more on that. I mean, I'm grounded in sort of public protection work, and I've spoken to many people over many years. And the one thing that I have learned is that quite often the first thing that people talk to you about is not the main issue. And actually having that conversation and basically to get a better understanding of the whole picture is really, really important.
Heidi.
Thank you, Sean. Firstly, I think it's a huge congratulations just how quickly this hub went up, you know, because I remember we were in that meeting saying that we can't wait till the next board to take action on this. And then there it was. And I firmly believe it's building on the success of the COVID hubs that was there. And then building on that is the trust, those conversations you spoke of, Sean, that is building trust. And trust is an important factor on how we take people with us. We spoke of community, a sense of community, you know, getting that back. And it's the building on that momentum that I do feel you have in those hubs. Councillor Lewis, you're saying all the things that I love to hear, you know, making every contact count. And I see John's hand is up as well. Statistics, I was just in a meeting the other day saying that it's usually the 10th contact that somebody stops smoking, you know, of giving that message. So you feel, oh, it's the second time and no, you know, but it's that one person that makes the difference. So I think we're really building on good work. Thank you.
Councillor Marsh.
Thank you, Chair. Just a general remark, which is that at the school where I'm chair of governors in what's considered a prosperous part of Newbury, relatively prosperous, we've got our own food bank, which is well used by parents. And that just kind of, I'm proud that the school does it, but it makes me quite angry that it's necessary. And reading this report, which is an excellent report, thank you, Sean, I do think I did feel very sad and angry about it, really. These measures should not be necessary. in a civilized country that's regarded as the fifth most wealthy country in the world. It's an absolute scandal, actually. And I think we should feel, while pleased with the fantastic work that's been done, pretty cross about it. Hopefully the picture will change in the next year or two. But Sean, I do know how hard you and other officers have worked on this, and I think that the Hub did some fantastic work, and that's obviously ongoing. So thank you. I've got a couple of questions about the Household Support Fund. So did we spend the whole of the £694,000? Did the council spend all that money? And looking at the figures for the current tranche, which is 1.389 million, and looking at the claims that have been approved so far, they seem like quite small amounts that have been paid out there. It only adds up to about, I know that's in the first month or two, but it only adds up to about less than £30,000. So I'm just wondering, are there large sums due to be paid in, for example, in school meals during the summer, or some other project? Because I can't see how we're going to get through it all, judging by those figures. Thank you.
Thank you, Councillor Marsh, and thanks for the kind words. Just obviously the Household Support Fund isn't in my area, but I do have some idea of where the money was spent. I do believe that the funding for the third tranche was spent. If it wasn't, I mean, it was pounds that were left rather than thousands. But I do know, basically, because I was involved in the oversight of the housing service at that time, that basically the money was by and large spent. I think the issue in terms of the Household Support Fund this year, so this is the first year that they've paid it as a full year. Normally it's been paid in 6-month tranches. But there was also, so it didn't actually launch till the 23rd of June. So at the time I wrote this paper, it hadn't been running very long. And so there was a flurry of applications at the beginning. I would imagine a lot of those 356 that I said were being processed, or sorry, the 581 and the 356 probably have moved forward now. So Pete Evans, who managed the community hub, is now managing this. So Pete is obviously very aware of the need. Sorry, managed the cost of living hub, is now managing this. So obviously he's very aware of the need to get the money out, basically where the criteria is met. There has been allocations this year basically for free school meals, vouchers basically during the holiday period, and that will have taken a proportion of the money out. I haven't got the detail in front of me. I can certainly pass that on. It is available. But I would imagine now the fund is up and running, they will probably start to get through payments quite quickly. But I can get more information and more of an update for the board and circulate that. So I'll speak to Nick, the housing manager.
Thank you. John Ashton.
Thanks. No, it was on the Household Support Fund. So I note that here it's managed out of housing. I was working last year as interim public health director in Northamptonshire, and I had the budget under my control as public health director. There are two issues really. There's getting the money out of the door and making sure it counts. And this is now Household Support 3, I think, or 4, the round that's just starting. There's much more discretion now about how that money is used in this round than there has been before, which has been much more prescriptive from London. I mean, we had already been doing other, perhaps more novel things. Firstly, by using voluntary organisations to reach people in need who are closer to the ground. And I don't know whether we're doing that, but I'd recommend that we think about that if we're not doing it, and who we're using to identify those who might benefit most. But then the sort of things it's used for. And so, for example, one of the things we did was recognising the problem for poorer families, disadvantaged families, when children move school at age 11 to afford school uniforms, so that the children are actually not feeling different from the others when they have to have a school uniform. So we put quite a bit of money into making sure that they were able to get proper school uniform if they needed to have a school uniform. So I'd just, be interested to know more detail about how we're reaching, who we're reaching, and what we're doing with, really, given that the terms of reference have become more liberal for this latest round. Thanks.
Yeah, if I may just pick up on those points. So there are a number of initiatives actually that have been funded out of the Household Support Fund. Unfortunately, I haven't got the papers in front of me, so I wouldn't want to go into too much detail in case I get it wrong. Can I propose what we do? Because one of the recommendations on this paper is that we come back to each meeting with an update report on the progression of this work. I'll bring back next time more detail basically on where the allocation for the Household Support Fund is going for this year.
Please, yeah, thank you. Councillor Stewart.
Thank you. I echo what's been said about the amazing work that Sean and the team have done, and I know personally from speaking to the previous leader, Lynn Doherty, she witnessed and felt the power of a team of people coming together with a real desire to make a difference, and that's exactly what you did. The piece that is very interesting to me, the whole report is, but in particular, the testimonies, I guess you could say, the current positions from the voluntary sector. And because I work in the voluntary sector and charities, I totally understand a lot of this, in particular the food bank talking about a reducing pool of volunteers. So we're not just talking about money issues, it's about how do we get people to continue to go out and to continue to be doing the amazing work that they've been doing as a volunteer. And we talked about communities, and I find it very interesting that we did come together as communities during the pandemic. I never felt more part of a community where I live than during those times, because we were all pulling together, and it was, how could we help each other? And I really hoped that that was going to continue once everything went back to normal. And of course it didn't. But I do think that there is still that the evidence that we have that we can do it is there, and that positive messaging, absolutely, we need to continue with that. So the one thing that I would really like us to be able to do is to really help people like the food bank, the Newbury Soup Kitchen, who also do an amazing piece of work. And in particular, one of the things that Newbury Soup Kitchen have reported that they're seeing is addictions are taking further hold again. So where we may have perhaps an increasing situation or an increasing problem with substance abuse potentially. So we don't want any of this to spiral any further than it does. We can't fix the world, clearly, and I'm not expecting Sean and his team to do that. But I think from the resolutions that we're being asked for here, I would absolutely wholeheartedly support anything more that we can do. And I think that you wish us to resolve that there is a meeting held in particular with the partners that we're working with. And I would absolutely support that, because we need to carry on. People are still struggling. And I'm afraid in some cases it's going to get worse before it gets better.
Thank you. Are there any other issues? Before we move on, I'd like to commend the work that you've done, Sean, and your team and all the other departments that have taken part in this. And I'd like, if you could pass that on, I'd be grateful. It's also heard some alarming figures yesterday about the number of people that are going to have to be spending hundreds of pounds a month more on their mortgages by the end of the year, and indeed beyond. Really alarming. And you mentioned increase of rentals. That's happened already, and some rents have gone up quite significantly. So I think there's going to be a lot of people going to be in a great deal of financial distress in coming months. So I do think we do need to carry on this work, and well, yes.
Chair, thank you very much for that. I think, I mean, obviously what we've got is a lot of factors interacting that are coming together, basically, which are going to, I think, be very, very challenging. And what Councillor Stuart just talked about there with the voluntary sector is one of those, and it's the same with donations and things like this to appeals. There is, I think the sooner we start this debate, again, the better. It hasn't really stopped, I guess, but what we're looking to do is to reaffirm that we do need to look at something urgently, basically, to look going forward, basically, what we can do again to pull together, as Councillor Stewart has said, as a community, to deliver something for the community.
Yes. The recommendation was to note the report, but also to resolve that the Conduct Protection Manager should arrange a meeting of the key partners as suggested, and should have received further updates. So is everybody agreed that that's the way forward? Thank you very much. Thank you.
Thank you, Chair. Can I just say one more thing? Obviously, I will get the meeting arranged, but I think in light of the discussion we've had today, I'll make sure that all of the members of the board are invited.
Please. Thank you. Move on to item 14, changes to pharmaceutical services. And it's back to you, April.
Thank you, Chair. So hopefully, again, you've all had a chance to review the report. So the basis of the report is to provide details of recent and planned changes to the pharmaceutical services in West Berkshire and advise the Health and Wellbeing Board on the implications for the West Berkshire pharmaceutical needs assessment. So just as a reminder, the West Berkshire Health and Wellbeing Board has a duty to keep its pharmaceutical needs assessment under review in light of any notifications of changes in provision of pharmaceutical services within the district. We have received some notifications. So we received a notification on the 11th of May from NHS England for a change of ownership for the community pharmacy in Bath Road, Crown Mead. The proposed change has been assessed in accordance with the national guidance and legislative requirements and is considered to have minimal impacts. We also received further notification on 22nd of June 23 from NHS England summarising the closures and changes to pharmaceutical services that had occurred in NHS England South East during Q4 22-23. So if I just bring you onto 4.4, we can see here some of the changes that have actually happened. So in terms of the Lloyd's Pharmacy in Crown Mead and Bath Road in Thatcham, that was a change of ownership that happened there. And then under 4.5, there was some various changes that happened at the 3 pharmacies here that have been noted. So once we receive notification about those changes, then we look at those changes and then we have to consider, do we need to refresh the pharmaceutical needs assessment? Do we need to issue a supplementary statement, or do we do nothing? In regard to the changes that have been discussed in the paper here, the recommendation was, going back to the front page, was to note the changes have been assessed as having a minimal impact on provision of pharmaceutical services, and agree that there is no requirement to update the pharmaceutical needs assessment or publish a supplementary statement. That gives a little bit of a summary of the paper for you.
Members have any? Councillor Stewart?
It was just a question. I noticed that some of the information that you've received is retrospective. Is there a requirement for NHS England to do this in advance, or actually are they in a situation where perhaps they're not always notified before these things take place?
Thank you, Councillor Stewart. We are notified. There is a process of notification. So I'm not sure why we didn't know all about, unless Gordon knows why we didn't. I'll let Gordon come in, probably safest for Gordon to answer correctly.
I suspect we only came up with the process at I think it's the April meeting. So some of these changes actually predated that. So they may not have actually had our up-to-date contacts, but we usually do get them coming through. There was a little bit of an admission in the last email that some local authorities may not have had this in advance. So I think it may have been on their side that they may have slipped up slightly.
Thank you. It's just, I was thinking about the last time we talked about this, there was some really quite difficult changes that were taking place. These ones seem to be a little less of an issue, but I would hate for it to be a situation where it's all taken place and then we're talking about it retrospectively.
Councillor Codley.
Thank you. I heard on news recently that Boots are looking at closing some pharmacies where they're in certain distances from one another. I just wondered if we had anything like that, if any of the ones in the district were going to be closing that we're aware of yet.
April.
Yeah, I'm not aware of anything at the moment. And obviously what we will do as soon as we hear about any notification, we will share that and obviously bring a report based on the implications of that. So I think, as Gordon was saying, we haven't had this process in place for very long, but I think we've got quite a good, robust process now, and we'll just make sure that we follow that process if we receive any notifications going forward.
Thank you.
Thank you, April. From my perspective, what I just want to put forward and highlight is if we can keep track of the accumulative effect. Councillor Stewart pointed out the last time it was a bit more significant. At this time, a few hours here and there, but the accumulative effect that this has for our West Berks population, please.
I presume the closures of the 2 pharmacies in Sainsbury's we've already considered as board in previous meetings. Thank you.
Yes, absolutely.
Okay. Any other points? Thank you. The next item is to receive or to note the report from the Buckinghamshire, Oxfordshire and Berkshire West ICB annual report. So I think we just take that as noted, if that's okay. Item 16, do we have any members' questions, please?
We haven't received any in advance of the meeting, Chairman.
Thank you. And then move on to item 17, the Health and Wellbeing Board Forward Plan. So basically inviting you to note the forward plan and suggest any changes or additions you might want to see.
Just to put the cost of living item on for the future meetings in light of the discussion we had earlier. And also, I think we did have a discussion about the housing condition survey, didn't
yes.
we?
Thank you.
Probably, Gordon, for that one, maybe we're looking more sort of December by the time we can get some analysis done and everything else.
Okay, thank you. Any other? Councillor Lewis.
It's more of a question, really, just taking up a possibility of a strategy for community hubs and that whole services we were talking about earlier. Could that be something that's
that I think we should include, yes. Whether we can, I don't know if we could make the title more generic or not, but yes.
Just make sure that we don't lose the impetus that is raised from this.
But, any other issues? Thank you. Item 18, the future meeting dates, ask you to note. And do we have any other business on the agenda? No, we don't. Okay, so there being no other business, then I'll close the meeting. Thank you very much for your attendance and your contribution, and thank you very much to Jordan and to Ben for supporting us. Thank you. And thank you very much for the remote contribution.